Good evening, everyone. It's Vrushangi Shah with the Fellowship Review through the American Journal of Healthcare Strategy. Today, I am thrilled to be joined by Anthony Stanowski, President and CEO for the Commission on Accreditation of Health Management Education, otherwise known as CAMI. Thank you, Anthony, for joining me today.
Vrushangi, thank you. It's a pleasure being here.
Yeah, absolutely. So let's just get started. Can you please tell me a little bit about yourself and also share a little bit about your career journey and how you got to the role that you have today?
Well, thanks, Vrushangi. I think that the most interesting part is you never really realize where you're going to wind up on the road that you're kind of traveling, particularly in the beginning part. I did my undergraduate degree, came out. I was a communications and psychology major. And so I was eligible for such great jobs as season ticket salesperson for the Philadelphia 76ers. And the Sixers weren't doing all that well at that particular point. I was also offered a job as a meter reader for Philadelphia Electric, which would have been really embarrassing as a magna cum laude graduate of the University of Pennsylvania. So I took neither of those jobs. Wound up as a fifth grade
Hmm.
teacher. And while I was teaching was a really interesting kind of part of my life because there I was, 21 years old. I got out of school in 3 years, and I one of my students' fathers died of
Mm.
cancer, and the school that I was teaching in was actually the same school that I went to as a child
Wow.
too. So having to counsel his mom about that was really a very tough thing
Mm.
for a young person to do at
Mhm.
that point. But it also kind of brought back to me a little bit of my own childhood where I had childhood cancer. And I recall the conversation I had just a little bit while I was still in school with the doctor who
Mm.
treated me. And his name was Dr. Sokoloff. He was at Thomas Jefferson University. And Dr. Sokoloff was telling me about how in Philadelphia, particularly in the area that I grew up, high incidence of cancer
Mm.
rate, really high incidence rate. And not surprisingly, we were bordered by the Philadelphia Schuylkill Expressway, the gas works, the trash to steam plant, an oil refinery, and a diesel powered electric camp. So I think all of those things kind of combined, probably contributed to a higher than average cancer incidence rate. I decided to go back and get my MBA in healthcare management, and I really want to say that probably was a major influence in me doing
Mhm.
that. So while there, I went to a CAMI accredited school, and they prepared me well. I did a fellowship, and that was really the thing that kind of changed my career because I was able to see how decisions were being
Mhm.
made at hospitals, what the board of directors was like, and how you did an analysis and how you presented it to move things forward. I'm really proud to say that the first project I worked on was the Cancer Prevention
Oh.
Center at Graduate Hospital. And as it turned out, the Cancer Prevention Center got approved and got activated. And I got to work with the physician who was leading it in a good, strong way. Now, my boss who I presented to at the time said, Anthony, you don't realize that this never happens. You never just get your first project, go through it, and get it
Mhm.
approved. But I think that really kind of ignited the passion for me about what going into healthcare was all about. And I think it was real exciting. So I spent from 1983 to about 1999 in hospitals and health systems in Philadelphia. Graduate Hospital became Graduate Health System. It was the largest health system in Philadelphia. I left and joined Mainline Health, which was a community hospital located in the Philly suburbs, which merged with Thomas
Mm.
Jefferson to form the first version of Jefferson Health System. I was the director of planning and market research, and another merger was coming down the pike. And I was really kind of tired of mergers at that point. I joined an organization called Sachs Group, which was doing planning and marketing for hospitals around the country. And I think that was really the part that got me into a national
Mm.
exposure with other professionals around the country, other really kind of great, smart people. And one of my clients, as Sachs Group grew, it became Solution, it became Thomson Reuters, it became the IBM Watson Healthcare Division. And I left right before the IBM
Mm.
acquisition occurred. I joined Aramark, and Aramark was my client, and they had an opening for a vice president of industry relations, which I absolutely loved. Vrushangi. It was an amazing opportunity to really kind of fund important projects with the generosity of Aramark. And one of the projects that we funded was to create a fellowship program. And it was really interesting because how that occurred was I talked to the president of the Institute for
Mm.
Diversity my very first week on the job, a guy named Fred Hobby. And Fred and I were comparing our careers, and he said, "You know what, Anthony? No one's doing fellowships anymore. Hospitals are cutting them back, and a lot of programs don't
Mhm.
require them." He turns to me and says, "Why doesn't Aramark do a fellowship?" And I'm thinking, how do I do a fellowship? I'm in a corporate office in Philadelphia on a high rise up on the 11th floor. And how do I do a fellowship? I went back, talked to my boss, a guy named Jeff Connor, an amazing person. He goes, "How'd your meeting with Fred go?" And I said,
Mhm.
"Really well." And I told him, I said, Fred said to me, "Why don't we do a fellowship?" And he goes, "Oh, fellowship, what's that?" So I kind of described what a fellowship is, how you spend departmental rotations, how you report to executives, how you interact, develop projects, meet with a lot of group people, sit on board meetings. He goes, He goes, "How much do fellows make?" And I gave him the salary amount that it was back then. He goes, "I'll come back to you tomorrow." Come back to me tomorrow with what? I'm going with what? Comes back to me, knocks on my door, says, "Anthony, good news. I got for you funding for 4 fellows this year, and your job performance review will be based on if you get the fellowship up and running." And he bolts out my door after that. I sit back and I go, how am I going to make this happen? So what we did is we designed a program where we put the fellows and we put them in an Aramark hospital, Aramark serviced
Mm.
hospital. Obviously Aramark isn't in the hospital business. They do food, environmental service,
Right.
and biomed. Put them in an Aramark hospital. They report it to the hospital executive. So the president or CEO of Henry Ford Hospital, the president and CEO of
Mm.
Advocate, of Mainline Health, of Susquehanna Hospital, hospitals in Detroit Medical Center, in the Houston Medical Center, all around the
Mm.
country, and we would bring the fellows together a couple times a year. We would take them to Aramark events, and they would see what we would do at Phillies games. We would take them to a prison, and they would see how Aramark serviced
Yeah.
prisons. We took a group to Ireland once, and they saw what we do at the Guinness factory. Now, I don't want this to sound like too much fun. We went to the Guinness factory with Aramark service, but then they also met with Irish
Mm.
CEOs and talked about the U.S. and Canadian healthcare system. We had a Canadian fellow, and they also talked to education folks and talked about what they learned and made comparisons and contrasts with the U.S., Canadian, and Irish health systems. It was
Yeah.
fascinating. They also did a project in conjunction with a university-based person, and we worked with folks like at Carnegie Mellon, at Wharton, at Penn State. Great, great, great sets of projects to do. So the folks at CAMI heard that there was this crazy guy in Philadelphia who was spending about $500,000 a year on fellows, and said we need to talk to him. So they made an appointment, came up and talked to me and the CEO at Aramark, and what they wanted was some money to fund global
Mm.
accreditation. And Aramark at the time was looking at how do we expand globally in healthcare? How do we consolidate our services? So we funded 2 research studies, and they asked me to be on the board. And Rasangi, let me tell you, I made a critical mistake at this point. So they asked me to sit on the
Mm.
board, and here's a mistake all your listeners need to make sure you write this down. Never ask any questions at a board meeting, because if you ask questions, you become the chairman of the board. So I was vice chair of the board at Aramark. I had been on for 5 years, and the president at the time said she was going to
Mm.
retire. And my comment was, please don't retire. I left Aramark at that point. I was with a technology company in New Jersey, Applied Medical Software. I was on the board at Bon Secours in Baltimore, Maryland. And all I kept thinking is, oh my God, I've got to do my day job on the board of a health system. And now I've got a mentor CEO on at CAMI. And at that time, 9 years ago, CAMI was in really bad shape. We were
Mm,
losing programs, we were losing corporate sponsors. We were at 90 days cash on hand. We were close to going out of
mm,
business. And I talked to another board member, and he said, "Why don't I do it?" And I looked at him and I went, "Tim, I never pictured ending my career with a failing nonprofit. Didn't make
right.
sense." And Tim said, "Anthony, if you do what you love," and I think this was the most important turning point for me, because if you do what you love and you're helping people, then it's worth more than any money you could do. I think that's an important
Yeah.
lesson for anyone. So I took the job, and I really want to say I haven't been happier
Hmm.
since I have not been happier. It's been the most fulfilling job of my career. Unfortunately, the other board member I talked to, passed away from pancreatic
Mm,
cancer, and we actually have a scholarship named for him, the Tim Campbell Scholarship. So, if any of you students out there in CAMI accredited programs, make sure you look at our scholarship page, because there's a Tim Campbell Scholarship and other scholarships that they could apply for as well too. So I think, if you look at your career, did I plan on, when I was growing up as a little boy, I thought, oh my God, it'd be really fun to be the president of an accreditor. No, no one, a fireman,
yeah.
policeman, those type of things, but never the president of accreditor. But it wound up that way.
Yeah, an incredible journey. I appreciate you not only sharing, your career journey, but also just your personal story. And what a beautiful tribute to name a scholarship and help students, ease the access barriers to education. And a lot of things that you said resonated with me as well. I went to CAMI accredited institutions. I also did a fellowship, and I'm so so grateful for my fellowship experience. So completely understand where you're coming from. And so, kind of transitioning to CAMI, what is something that you want our listeners to know about CAMI as an organization? And kind of the second part about that question is, can you speak more about the fellowship opportunity?
Yeah. Well, let me talk about the first part first, because if you go on the social media, there's a lot of stories about CAMI, and it's really kind of interesting to kind of listen to. I think that the important part about CAMI is its mission, and you go to the mission. And I really want to say, as the CEO, I look at decisions and I think about our mission. And our mission is to serve the public purpose by advancing the quality of healthcare management education. Serve the public purpose by advancing the quality of healthcare management education. We do that in 4 ways. We set standards, and then number 2 is we help programs meet those standards. Very strange, because most people think of an accreditor as the people with the little book with the little checks and minuses on it. No, what we do is we set the standards, we help programs meet those standards, and then once they meet those standards, we tell the public about it, and we also tell the students about the types of programs to look for. Now, the standards are hard, and they're based on criteria and standards by academics and leading practitioners. And to meet the standards is very, very, very significant. Now, I said CAMI helps programs meet those standards, but we also have programs that we de-accredit. And we also have programs that we don't accredit the first time through. So we help them kind of move along. Now, why do we do all that? Well, number one, you look at our vision statement. Our vision statement is we want to work to make sure that students are well prepared to lead in healthcare. So it's all about the listeners to this podcast. It's all about the students, making sure that you're well prepared. Like you said, you became well prepared, and I'm looking at your diplomas. It's SLU, right? At St.
SLU
Louis.
and USC, yes.
Okay. Yeah. So, those are two CAMI accredited
Yes.
programs. And, our goal with those programs is to make sure there's great students like you out there who are going to make change. And I think that's really kind of critical with
Hmm.
that. So that's the important part about CAMI. We accredit 150 programs in the US and Canada, soon to be global. The work that, remember, that Aramark funded like
Yes.
15 years ago, we finally have come true, and we will be visiting 2 programs in Saudi Arabia. One this November, and then the second one in like January or February. So I'm
Incredible.
really excited about that. And then we've got a few more kind of coming in other parts of the world as well too. So we've got a global reach, and we're making sure that students across the globe are well prepared to lead. So that's what we're doing now. What I'm excited about and why I'm on this podcast, and thank you very much for this opportunity. But Aramark worked with the Joint Commission,
Mm-hmm.
and I talked to you about my career at Saks Group and Solutions, and before Aramark, one of the great people that I got to meet during that point was Jonathan Perlin, Dr. Perlin, and he had just left the VA and joined the HCA. He was my primary point of contact at HCA. They were my biggest client
Mm.
at the time that I was working with. And John was just a phenomenal person. He had a great team, and they really worked. It was interesting because people, you talk to outside the hospital, the for-profit healthcare industry, smaller community hospitals would go, oh, HCA doesn't care about quality. They're just concerned about making money. Absolutely false.
Mm.
People like John Perlin set up very, very sophisticated benchmarking tools, both on a clinical and an operational point of view. And I tell you, working with John on that was probably one of the highlights of my career.
Wow.
Just a great guy. So John and I stayed in touch through the years. I joined CAMI. I pinged him, let him know, and then about a year and a half ago, I think just about a year and a half ago, he joined the Joint Commission as the CEO. And for the listeners out there, the Joint Commission is the largest accreditor of hospitals and other healthcare providers across the globe. And John, to me, he is someone that's going to make a significant change
Mm.
in healthcare. And one of the areas that he's focused on is sustainability. He said, he said this to me at a lunch, he goes, if hospitals were a country, they would be the seventh largest polluter in the world.
Whoa.
And he goes, and think about the Hippocratic Oath, which is first, do
Do no
no harm.
harm.
And what are we doing? We're doing harm.
Mm.
How do we change that? How do we change the industry? So John is really interested in sustainability, and he talked to me, and we actually have, CAMI has a program award for sustainability that we do with Canon Solutions America, which is, again, one of those organizations that's committed to sustainability, not just as, this is a nice thing but they're really all involved with it. And they fund an award for programs around sustainability. So I told John about this, and he goes, well, we should do something together too. And I went back to the fellowships, and I said, John, what do you think about funding of fellowships? And John was a graduate of VCU, a CAMI accredited program. He's also a medical doctor, and just, again, really one of the smartest people you could ever meet, most passionate people you could ever meet. And John said, we sat down at lunch and we kind of spec'd out a fellowship program. And what it is, similar to what we did in the old Aramark days,
Right.
is it's CAMI and the Joint Commission getting together. The student, the fellow, reports to the Joint Commission. They work out of Chicago in the Joint Commission's office.
Mm.
They do project work as assigned by the Joint Commission, particularly focused on their sustainability initiatives, but they are going to get to visit hospitals and be part of site visits and other programmatic and special work, go to board meetings, get to meet some folks, get to do some really wonderful mentorship opportunities with John Perlin and other folks, Mark Grafton at the Joint Commission, do those kind of wonderful things. But they're also got, with CAMI, we want them to go on a CAMI site visit and see what we're doing. And then the fellow this year is tasked with writing a white paper that says, how do we need to work together better to really foster and engender sustainability? So that's her project this year. We picked a fellow that's just amazing. Sadie is just an amazing fellow, just doing a wonderful job. Came from Rush University, and just an amazing part. So this is the first year, and when the Joint Commission has kind of seen how the fellowship has kind of moved through, they immediately went to a second year for the fellowship. So our fellowship opportunity is open right now. I think it closes really soon, September 27th. Now, hopefully we do one again in 2026, but this is the fellow for 2025, starting July 2025 and ending June 2026. Again, closes September 27th. 2024.
Got it.
So open to any students out there from CAMI accredited programs.
That's incredible, and it seems like such a unique opportunity. And you answered so many of my questions. I was going to ask you why Joint Commission, and also, what prompted the venture, and you kind of touched on that already. So, I guess what I want to ask you next is, what is an absolute must know for interested candidates? What do you believe are the most significant benefits of applying and doing this fellowship?
Yeah, well, I think the uniqueness of this fellowship is very similar to the what I call the uniqueness of the Aramark fellowship when I was with them and we did that. What we want to do with this is, I think a lot of students go, oh, I want to do a fellowship. I want to go work for a hospital, and usually they'll say 9 times out of 10, Cleveland Clinic is my first choice. Them and 72,000 other students want to go work in Cleveland Clinic. And Cleveland Clinic is a fabulous fellowship.
Absolutely.
It is, right. And then there's Advocate, and there's several others that are kind of the must see ones.
Hmm.
What we think with the Joint Commission is the ability to see how the Joint Commission conducts their reviews is something that no student's ever seen before.
Yes.
And to work at a very senior level within the Joint Commission is significant.
Yes.
So I think those two things are really unique. The focus on sustainability is also really unique. So I think, to me, if I'm a student and I go through the Joint Commission part, it makes me more valuable for my next job,
Hmm.
which might be with the Joint Commission, might stay with, or it could be in the hospital industry, or it could be a consultant, or it could be with physician practice management. I mean, you could go anywhere from there to kind of look at how do you kind of improve and where do you kind of move from there. So to me, that's the incredible value. You're not coming out with the plain vanilla, I did my fellowship at, X community hospital or X big city hospital, but you're doing something a little different, a little unique, but still gaining all of the analytical experiences that you need to do out of it.
Yeah, absolutely. And I think I caught this, but just to clarify for our listeners, a lot of fellowships are built with the idea that you do have the opportunity to stay on for the future. So is that also true? I think I heard you say this, but is it also true that a fellow can complete the fellowship and then stay on with the Joint Commission?
There's no
Of
guarantees,
course.
and I just want to kind of be clear with that. And I think, even with I want to kind of bring that back to my own fellowship experience when I did that at Graduate
Sure.
Hospital. There was a 1 year fellowship, and it ended June 30th. And I've been asking my boss about, am I going to stay on? And it's like, well, Anthony, we're working to make a spot for you, and we're trying to do it. And I think it was June 29th where she came to me and said, well, good news, we'll keep you on for another year. So, it was that level of experience for me. Now, I don't know what the Joint Commission is going to do afterwards,
Sure.
and there's no long-term commitment, but there's certainly that possibility.
Got it. No, and I mean, it's an incredible experience regardless. But I think to our listeners, I also want to highlight having done a fellowship, that is the common notion, right? No guarantees, but fellowship organizations, such as the one where I did my fellowship, at UCLA Health, there is a strong effort to find a home for you post fellowship. But yes, remember, no guarantees.
No guarantees.
Yes. And kind of my last two questions for you. Really have appreciated everything you've said so far. And you touched on this a little bit, but would you be able to provide a little more insight into what other kind of mentorship and professional development opportunities, the most significant ones in your opinion, that this fellowship could offer?
Okay. Well, before I do that, I don't want to forget this. Is CAMI has done a white paper on fellowships.
Mm,
So if you go to cami.org, and if you remember this, if you go cami.org/white
okay.
papers, you'll go right to the site where all the white papers are. And we did a really great white paper in coordination with the National Center for Healthcare Leadership. So if you want to know how much fellows are making, it would be a place to go. Or if you want to understand, what people are looking for when they hire fellows, because we actually kind of talked through that along with
Mm,
some data from NCHL. So it's a great resource for students to go to. So what other opportunities are there? And I think, if I'm a student, absolutely want to do a fellowship. And I think sometimes you talk to students and they go, well, geez, why do I want to do a fellowship? If I go and get a job, I might make more than my fellowship.
Mm,
And so I'm giving up money by doing a fellowship. Why do I want
right.
to give up some money to do it? And my answer to that is yes, you're giving up money, but you really look at it as you're investing in yourself. Now, first of
Yes.
all, you will get paid for a fellowship. And what I want to say is if you go to some place and they offer you a fellowship and you don't get paid, I think you should walk away
Mm,
because then they're really not invested in you to do that. So that's just an aside. There might be reasons why you want to do it, and again, I would just look at it very carefully. But you should look for a paid fellowship.
mhm.
So number one, it's an investment in yourself, although you might make a little bit less money because it will take you years before you step back in the boardroom.
Yep.
And for me, it took me a couple decades. I know the students out there are a lot smarter than I am. So I think you might be able to get into the boardroom a little quicker than I did.
Sure.
But, it takes a while. And being able to see and understand and do the departmental rotations and work with different executives are all benefits
Yes.
that, it takes you a long time to see. So I think, that's an important part with doing it. I would say, other things to look for is look for, internships as you kind of go along your student, depending on where you are.
Mhm.
Obviously a fellowship is a postgraduate experience, and some schools actually require a residency, which is structured similar to a fellowship. I think there's only about a handful of programs, less than a dozen, that still require a residency.
Mhm.
That's there to get their graduate, to get their degree. But you know, if you are in your first year, look at some opportunities.
Yes.
And with those, you can volunteer for a short-term internship. You
Mhm.
will learn things on that. So again, I would still, kind of look at those as, what are some good learning opportunities for you to do. Also, take advantage of the professional associations that are out there. ACHE is far and away the biggest and
Yes.
the broadest, but it's not for everybody. If you are into supply chain, as an example, you might want to look at the American Hospital Association's professional membership groups. In
Mm.
human resources, AHA's got a wonderful association around human resources, or healthcare planning and market development. The Society for Healthcare Strategy and Market Development of AHA is wonderful. So ACHE is a very generalist, big tent organization for healthcare executives and people in management. AHA's professional membership groups are interesting. If you're interested in finance, HFMA, the
Mhm.
Healthcare Financial Management Association, is wonderful. Physician practice management, the Medical Group Management Association is great. Quality and Safety, National Association of Healthcare Quality. Some of these are on CAMI's website, and a lot of them are corporate members to kind of look through.
Mhm.
But I think you can tag on to a professional association that makes sense for you. Now, I know a lot of folks are students out there and they're going, geez, I've got to spend some more money
Yeah.
on this. But you got to look at it as an investment.
Yes.
It's an investment in yourself. And look, if you're not willing to invest in yourself, but go spend $1,200 or $1,400 or $1,600 for an iPhone, what does that say?
Right?
$100 a year, 100, and ACHE gives a nice discount for student fellows coming out is really a worthwhile investment. So I think those are probably the biggest mentorship. Now, the other thing is once you sign up with it, first of all, don't sign up with all 8 and go, I'm going to do them all. No, pick one.
Yeah.
Okay. Try to join one where there's a local chapter. ACHE has wonderful local chapters. So does HFMA and a lot of other organizations, and get involved. And the first thing I would say is call up the president of the chapter and say, hi, I'm new.
Mhm.
I'd like to do something at the chapter. When's your next event? And can I register people? No one wants to register people. No one. It's the worst job in the world. No one likes doing it. As a student, it's absolutely, positively, 100% the best job because you get to meet every executive.
Exactly.
And if you get there early and you get the list, you can go, ooh, the executive I want to meet is the guy from Advocate or the guy from Methodist
Right.
or the guy from, or the woman from the female leader from, this hospital. And I think you can go around and go, these are the people I want to get a hold of. And make sure you kind of look them up, and as you're prepping LinkedIn, so you know their faces and everything. And then when they come up, you go, oh, hi, Sally, just wanted to introduce yourself. introduced myself, and I heard you're doing some really kind of interesting things at Advocate. Could I spend a little time with you talking about that?
Yeah.
Those little things are a great way to get invested. Also, when you go, the first words out of your mouth should not be, "Do you have a job for me?"
No, don't
Right?
do that.
What can I do for you? How can I help you?
Yeah.
And I think that's the great thing. And I think that's the wonderful part about your organization. I mean, Cole, I met him, and Cole was what, how can I help you, Anthony? And I looked at Cole and I just went, geez, what a great guy.
Yes.
I'm happy to kind of help him along, and what you're doing with the journal and everything, I think is really cool. And it's totally impressive, the early careerists that you all are working together
Mhm.
and really trying to help other people learn more about fellowships, bring that along. It's just the coolest thing in the world. I wish you all the best of luck.
Thank you.
It's what you've done is, that's an example of what people need to do, because all of you are going, how can I help other students find a good fellowship?
Absolutely. Absolutely.
You're all going to get it very far in your careers.
Well, thank you. And service to others is just an incredible core value of mine. And so I have found the fellowship process to be so incredibly rewarding. And I feel like I'm still reaping the benefits. It's been so incredible that I want people to know that fellowships, you should do a fellowship. I'm so biased when it comes to that.
Yeah.
The very last question that I want to ask you, you've had an incredible career journey. So, if you had to give one piece of advice or one key takeaway for our listeners, not only people interested in fellowships, but also just early careerists in general, what would you want to leave them with?
Yeah, and I think you nailed it. It's service to others. How can I help other
Mm,
people? And I think if you kind of go through with that mentality, how can I help other people succeed? Then you yourself will succeed. And I think that's, I mean, you said it first, so I'm just kind of jumping on your thing. But no, I think that's really absolutely the best piece of advice to give anyone that's out there. And, again, lifelong learning is important. I think, there's all those rules out for people, but helping other people's is great. In fact, the Tim Campbell Scholarship
mhm.
is all about helping others, selfless service to others too.
Yeah.
So, we recognize that at CAMI.
Yeah, absolutely. Well, Anthony, thank you so much. I know it's later where you are than where I am, so I just appreciate your time this evening. And I know our listeners will have a wonderful time listening to this episode and just taking all the advice that you've left. And of course, apply to your fellowship as well. And with that, everyone, this is the end of our episode. Thank you so much for listening. Thank you, Anthony.
Thank you very much.